and have to reuse these masks shift after shift? Hundreds of healthcare workers have died from COVID-19, and tens of thousands have become infected. It should be zero on both counts for these healthcare workers if they had the right equipment. You know, how are we in this many months into this and still don't have what we need? That's why we have a Defense Production Act. You know, Mr. President, use your authority, Mr. President. Use it this week. Scale up the production of N95 masks. You know, the steps you've taken so far haven't gotten the job done, Mr. President.
I could have sworn.
Fix the shortage of PPE for our healthcare workers before you tee off another round of golf. We can't just look at where we are today.
The only thing this nigga gotta talk about is Trump.
And gloves and face shields for the foreseeable future. And we need to be ready. We know more is coming. For the foreseeable
future.
Thirdly, we should be laser focused on treatments and vaccines.
Man,
we should be leading a coordinated global approach on the science, not disregarding experts while pushing dangerous and disproved drugs as if they're treatments.
Experts.
There's been some progress toward treatment and vaccines, but the administration hasn't been transparent about how they plan to manufacture enough doses to make sure there's equitable distribution to scale.
What?
I hope they're doing it now.
What?
I called for a while ago. They should be providing $250 million, enough doses to make sure there's equitable distribution to scale.
What?
I hope they're doing it now. Transparent about how they plan to manufacture enough doses
to make
sure there's equitable distribution to scale. I hope they're doing it now. I called for a while ago. They should be providing $250 million to have a plan now exactly how they're going to distribute this so every American has access when and if the vaccine's available. They may be doing it, but we have no transparency.
What?
Let us see, Mr. President. The White House should report weekly on this progress.
See what?
We can't end up in the same scratchy and distribution problems that we had in testing.
What?
We need to make sure the customers aren't being gouged by new drug and therapies.
Or injecting y'all with some shit that he already know this job about to get.
We have to immediately restore our relationship with the World Health Organization.
World Health.
All its shortcomings and missteps around COVID-19. This is why WHO was created. It is essential to coordinating a global response during a pandemic. And the United States should be leading that response as we had in the past. COVID-19 will likely worsen.
Leading the response had to do anything.
At the outset of the flu season.
Why we got to be first somebody?
So we need to put in place measures now to ensure the seasonal flu vaccine can be ready, available, and administered safely to those who need it.
Now you're talking about the seasonal
flu social distancing guidelines,
vaccine,
especially for seniors.
Seniors.
Fourthly,
he gonna take it first.
We need real plans.
He got a mask on.
Real guidelines with uniform nationwide standards to help us chart our economic reopening.
The economy is open.
Whatever we've been doing now is not working.
How?
The state-by-state approach will only produce confusion and slow any progress.
Okay, so now he said
you all reported the CDC.
He just proved to y'all the state-by-state approach. So what is this man talking about? How is he going to say something bad about Donald Trump not doing what he's supposed to do when it's really a state-by-state approach? So really state-by-state meaning you need to talk to your state governor if something is happening that's not supposed to be happening. But yeah, we'll keep going.
Trying to clear...
But yeah, meaning that it's not on Donald Trump that these niggas not doing what they supposed to do if it was a virus or something going around. Yeah, let's keep going.
Guidelines about what stages of reopening should look like.
What stage?
The administration delayed to scale back those plans. We need clear evidence-based steps that states can adopt now. Both the standard must be met in order to safely proceed with further openings and the reimposition of social distancing rules when cases begin to rise. You know, this is not rocket science.
It sounds like
we need to support schools and child care programs so parents, if and when they can return to work, are confident that their children will be safe and cared for.
I thought
You know, we should be holding and providing a sticker, say, safe for shoppers, a certification to stores that prove they're minimizing their customers' risk and exposure.
Did you do that?
A sticker, say, safe for shoppers.
Safe for shoppers.
A certification to stores that prove they're minimizing their customers' risk and exposure.
Certification for stores.
We absolutely need a clear message from the very top of our federal government that everyone needs to wear a mask in public.
He is in public with no mask.
Wear a mask. It's not just about you. It's about your family.
It looks like it's about him.
It's about your neighbors.
It's
about your colleagues. It's about keeping other people safe. It helps you, yes, but it's about keeping other people
What about the
safe.
niggas that gotta pick that mask up? I mean, they pick that mic up after he get done talking.
It's a simple measure. There's also one of the most effective ways we can do the right thing. It may be inconvenient. It may be uncomfortable. But it's the right thing to do as an American.
Maybe uncomfortable, but you don't have it on as an American right now, and you're trying to be the president. I'm done.
And finally,